Hello, today we will be discussing Guillain-Barré syndrome, or GBS for short. This is being presented by Brooke Boynton, Shaughnessy Eaton, and Rachel Rumsey. GBS causes the axonal demyelination of peripheral nerves. We have learned in our functional neuroscience class that this will slow down the transmission of signals to peripheral areas, affecting motor and sensory functioning. Physical characteristics include paralysis, starting with the feet and ascending upward, pain in the legs, absence of deep tendon reflexes, mild sensory loss and a glove and stocking distribution, meaning the sensation loss can feel like wearing gloves and stockings. The sensations usually stop at the wrists and ankles, but can progress up the legs and arms over time. In addition, people diagnosed with GBS may experience cranial nerve dysfunction, resulting in possible facial palsy and swallowing problems, as well as postural hypertension and tachycardia, respiratory muscle paralysis, fatigue, and urinary dysfunction. As this is a peripheral issue, the central nervous system, and therefore cognition, remain intact. Regarding emotional changes, people may experience shock, despair, fear, and pain after receiving this diagnosis and experiencing these symptoms. Diagnosis of Guillain-Barré syndrome includes taking a history of symptoms. There will be a physical examination and neurological exam, which includes nerve conduction tests and cerebral spinal fluid analysis. The cause of the disease is still unclear, but GBS is 1.5 times more common in men. The affected peak ages include adults from ages 20 to 24 and 70 to 74 years old. The assessments we chose for clients with GBS are the CARE assessment, use of a dynamometer, and an assessment for sensation such as light touch. Now, Rachel will discuss our assessments.
One of the first assessments an OT would want to complete is the CARE assessment. This assessment is important because it can show an OT how the client is able to complete tasks, what they are struggling with, safety concerns, and much more. This is a standardized assessment, but to consider a modified version, OTs may narrow their focus to areas 4, 5, and 6 of the CARE, listed in the bullet points. Next, an OT would want to test a client's grip/pinch strength with the dynamometer because they have decreased tendon reflexes that lead to muscle weakness due to GBS. This is a standardized assessment that measures force, torque, and power. Finally, an OT would want to test the client's sensation using light touch, sharp dull, or hot cold, because they have a mild loss of sensation. The OT would use a cotton ball, fingertip, or Q-tip and test sensation proximally to distally. Also, an OT may use a paperclip or safety pin and test sharp or dull sensation. We would use clinical reasoning to synthesize this information with their safety assessment. Pain should be addressed as it is a large part of GBS. It is a common and often severe symptom throughout the duration of GBS. It frequently onsets as the first symptoms, but may even last for a year. Pain in GBS requires our full attention and should be a main discussion throughout treatment. Due to the nature of peripheral sensory nerve involvement, a client's pain is often more severe. It is recommended that as therapists we use a safety-first approach, which means teaching your patient to perform only activities he or she can do safely. Since OTs work closely with other medical disciplines, we should be aware of the various treatments a person with GBS may go through outside of our time working with them. Medical treatment looks to lessen severity of the disease, not necessarily cure it. Patients are admitted to the hospital to be monitored. Treatments include intravenous immunoglobulin, plasma exchange, and steroids. Now I am handing it over to Shaughnessy to discuss possible interventions.
The interventions we chose for someone with GBS were texture bends, therapy, and patient education. The first intervention an OT would perform with a client who has GBS would be using sensory bins. These bins could contain different textures such as rice, corn, beans, oats, and much more. Within the bins, a client would have to look for specific items without looking, such as coins, buttons, beads, and animals. Completing this activity could help improve or maintain the client's sensation and perception. Another intervention an OT could do is using therapy. Therapy could be used to increase the strength in the client's hands by having them do specific stretches and exercises with the putty. They could also place coins into the therapy and remove them using one hand at a time to improve dexterity as well. Lastly, and probably the most important, is doing client education. This is important because the client will need to understand the challenges that are potential safety concerns to functional daily living. They also need to learn about energy conservation, as they will most likely tire quickly and could use break sessions and adaptations to help with pain management. To conclude, our main takeaways to remember with Guillain-Barre syndrome is that the client will likely experience numbness and pain, experience distal muscle weakness, and have impaired balance. There are many treatment options, and the OT should focus on pain management, energy conservation, improved sensory input and perception, as well as motor control. These are our references. Thank you for watching our presentation.